In Delaware, a huge showing at this year's retreat hosted by the Delaware Cancer Consortium. And the purpose of today was to share findings on cancer research and reduction, while the goal of the consortium is to reduce cancer rates across the state.
From our physical education and health education teachers to our physicians to our public health practitioners to our nonprofit organizations like the YMCA, American Heart Association, and others, to understand how we work together in promoting an environment in all settings.
This year, they are focusing on children and discussing ways to urge kids to adopt healthier lifestyles. The reason they want to do this is because prevention is far more effective than treatment when it comes to cancer. Well, the consortium was originally formed in March 2001 to advise the governor and legislature on the causes of cancer, incidence, and mortality. But one way to gear this message towards children could be through schools. As 47 ABC's Lili Zhang reports, advocates and health experts are eyeing possible policy changes in the educational system.
They should have physical education every day. Just like math, just like English, it is a core subject.
That's Dr. Irene Kuchina pinpointing one policy change she says is needed in schools across the country. The former president of Shape America, an organization dedicated to health and physical educators, Kuchina says a focus on physical activity is vital towards reducing rates of cancer, something Dr. James Spellman agrees with.
As a species, we evolved on the savannas either being chased as food or chasing our food. And then the first thing we do is we put kids in cubicles and tell them to sit down and work against our evolutionary nature, which is to run.
Dr. Spellman is a surgical oncologist at BB Healthcare. He says lung cancer in particular is prevalent in the first state. Delaware Health and Social Services reports it accounted for 14.4% of all newly diagnosed cancer cases between 2008 and 2012. According to Spellman, physically active people are less likely to engage in behaviors like smoking and unhealthy diets, factors the CDC recognizes as risks for lung cancer. As it stands, school children are recommended to get at least an hour of physical activity each day. However, Delaware Governor John Carney says he'd be open to implementing more in the public school systems.
One of the really challenging things is we've seen more and more young people with what we used to call adult onset diabetes, type 2 diabetes. That's a very expensive healthcare condition, and one that we want to reduce and at least control.
To promote healthier lifestyles and reduce as much sickness as possible.
These are our future. The kids are our future. And so why would you want your future to look so dismal?
Lili Zhang, 47 ABC.
Now, in an effort to detect lung cancer early, Delaware's Division of Public Health launched the Screening for Life program for qualified Delawareans in 2015. The screening is available for qualified and former smokers deemed at high risk.